So I can tell you that women's health care in this country is horrible, and by every single measure, black women's health care is worse. And certainly we've seen that when it comes to maternal health care. And I could sit here and, having given birth 4 times, I could probably tell you a lot of the reasons why. I could probably surmise about not getting prenatal care or not having the care people need in the aftermath of giving birth when we know things are really difficult mental health-wise and needing help to take care of their children that they've just given birth to. But guess what? What we really need is data. What we really need is to put the resources in to understanding the scope of the problem and why it's happening. What we really need to do is understand, for example, as my friend Shanique Spade has said, is that black women often are more susceptible to fibroids and what that might do to a pregnancy. What we really need to do is make sure that as people are going to the doctors after they start menstruating, that they are getting checkups, that they are being asked by the doctors about their health, which, quite frankly, having several daughters, they're not getting asked right now about how it's going. So what we have to have is resources, and that's why it's great that we have built the facility that we are currently building and investing in Trenton, but that is not going to be enough if we do not put the resources into addressing women's health care, particularly black women's health care. And I will tell you right now, we are not doing that. We have not done that in the whole history of the United States of America. And unless and until we take women's health care and black women's health care seriously, we are not going to see the results that we want.
Let me start by saying that Governor Murphy has done a good job and should be commended for investing money in this and acknowledging the problem. And it's a stubborn problem because the problem hasn't decreased over time. And you could ask yourself why. And I would tell you that, yes, education is part of it and social services is part of it. But at the core of the problem in New Jersey is you have a healthcare system that is rotten to the core, where Horizon has an absolute monopoly on everything that happens in the state of New Jersey. If you're not willing to address Horizon and create competition there, you will never get the outcomes that we seek here for every community, particularly minority communities. And I want to tie that together for a little bit. In New Jersey, you have a unique phenomenon that's also allowed that is counter to patient outcomes, where hospitals consolidate and you have 3 or 4 monopoly systems in the entire state of New Jersey of hospitals. And often, the hospitals that are focused on with the most financial resources are not the urban hospitals, they're the suburban hospitals because of the insurance payers there, again with Horizon. And I'll also tell you that the hospitals are often in partnership with Horizon, which, if you take a step back from a business standpoint, is something that shouldn't be permitted because by nature they are conflicted, and the fact that they are driving revenues together speaks to the fact that they are not focused on patient outcome. The reality is that healthcare in New Jersey has gone sideways, where your doctor and your medical provider doesn't control your outcome anymore. It's controlled by the insurance company, Horizon, and the hospital provider, and that dictates what ultimately happens. And let me tie that back together, particularly around urban and minority communities. The fact that urban and minority communities often have less access to education on how to push back around on Horizon, back on reimbursement, to get better testing, to better health care, that is at the core of the issue that needs to be addressed. So I think that if you're not willing to really speak to the core issue of who drives the healthcare problem here, you're never going to solve the issue here, particularly in the minority community.